I suppose a couple of weeks before the appointment, I would then run through with them and tell them what it's about. Well, if I feel I want to share that. But I'd tell them when it is, the time, what I would need them to do, sort of the nature of the appointment as well, and things that I need to take, just the practical information for the day. I've just started using Google Workspace, so I've found that it's helpful to put those sort of big days, big events on the calendar, and then I can share that with whoever's working with me on the day, so that we've both got a reminder. Wherever possible, if I need anything specific for the appointment, an example would be a hoist. I double check. I would probably ring initially once the appointment has come through to make the requests, and I nearly always ring a couple of days in advance just to check, because in my experience messages don't always go through, and I've been to appointments before where I've not been able to have a particular test or procedure because nobody got the memo and hoist wasn't available. I shouldn't have to, but I think to make things go smoother, I do like to check that everything's in place, so it's not a wasted journey or a wasted appointment.
Usually we would have a planning session, so it was very good at planning stuff, so we would have a plan in place. So she would give us the heads up when she got the appointment. She would let us know which one of us it was that were going to take her to the appointment, whether we were going to actually have two of us. If it was a long day appointment, she might need two of us to go with her, and what's involved and what she would need us to do on the day.
Preparation makes a big difference. I confirm the time, location, and any accessibility arrangements. I also make sure my employer has everything she needs. I ask her if we need to take a urine sample with us as well. If it's a longer appointment, I will make sure I have packed everything in the trolley. I will ask what the plans are for my rest breaks and lunch.
Doctors, medical professionals might talk to my PAs and not me. I try not to react too quickly, but it does annoy me and makes me feel like I'm not being recognised as being my own person and having the competency to talk about myself. Like the other day, when I had my jabs, and the person doing the COVID and flu jabs, they were asking, they said, is she allergic to eggs? And I said, no, I'm not. And it was about 5 questions. And he would ask my PA. I don't think it's deliberate, but it's just a lack of awareness and sensitivity.
I would just be listening in and making sure that they were listening to her and not deferring to me, and talking to her as a person and making sure that her point got across. Most of the time, certainly with Sarah, she can advocate for herself and she's very coherent. If you've got a different person that you're supporting that might have learning difficulties, then you might need to just ask the health professional to rephrase the question to a level that they can understand.
A few years ago, I was admitted for a procedure up in London, and there were times where I was quite weak and I had a lot of secretions built up, which meant I couldn't communicate effectively and safely. So I was happy for my PAs to communicate what I was trying to say to the doctors there, because it wasn't safe for me to talk. And they knew that, and it worked very, very well.
Once, during a specialist appointment, I noticed the doctor was speaking to my employer as if they didn't understand what was happening and had a learning disability. I quickly informed them that she was of sound mind and understood everything. I also reminded them to speak with her and remember she knows far more about her health than he does. That small step made the rest of the conversation much easier, and my employer later said they felt more in control and informed.
Obviously with complex needs, things might change health-wise. For someone like Sarah on a full-time ventilator, it might be that she'll suddenly have a choke, or we might need to just intervene, or she might need a ventilator, the battery might run out, so we might need to just jump on and change vent tubes, that sort of thing. Just being mindful of any small changes that might affect the appointment and the way it goes.
Hospital appointments can be quite daunting and you feel under pressure, so it's helpful to have another person to remember stuff. You know, as I get older, it gets a bit harder.
You know, it's part of our PA role is to be there to be supportive and help Sarah to keep well and safe going forward. So sharing that information just brings us closer together. I mean, I quite often refer to Sarah as she's not my boss. It doesn't feel like coming to work. You know, we've got that. I think all of us have been here with you so long. We know Sarah really well, and she's like a friend. So you're always going to look out for your friend, aren't you, and make sure she gets the best treatment.
Before the appointment, I talked with my employer about what they want to discuss. If they request support during the appointment, I can help by reminding them of any questions they want to ask, clarifying information as needed, or taking notes. But I always make sure they lead the conversation. My role is to support their voice, not speak for them.
Having a PA with me definitely makes me less anxious. It means that I can concentrate on the day itself, on, you know, the important bits, without worrying about all the practical elements.
The main thing would be to be mindful of their needs and the fact that they are a person in their own right, a bit like the healthcare professional, being mindful as well. So letting them advocate as much as possible, but being there to support and help.
Plan. Confirm the time, location, transport arrangements and accessibility needs, for example parking, lifts or accessible toilets. Check preferences. Ask how your employer wants you to support them, for example taking notes, speaking up or just being present. Assist with logistics. Help with forms, paperwork or checking in at reception if asked. Respect communication choices. Let your employer lead conversations with the healthcare professional unless they ask you to step in. Take notes if requested. Record key information such as medication changes, follow-up dates or specific instructions. Provide physical support. Assist with mobility, transfers or positioning as directed. Maintain confidentiality. Keep all medical information private unless your employer says otherwise. Stay calm and reassuring. Medical settings can be stressful. Your steady presence matters. Debrief afterwards if desired. Check if your employer would like to review what was discussed before leaving.
Don't speak for your employer unless they've asked you to. They should remain in control of their own healthcare. Don't assume needs. Always check before helping with mobility, forms or medical discussions. Don't interrupt. Let your employer and healthcare professional have their conversation. Don't overshare. Refrain from disclosing unnecessary personal information about your employer. Don't rush them. Allow time for your employer to process information, ask questions, or make decisions. Don't ignore boundaries. Some medical matters may be very private. Respect their wishes if they want you to step outside for part of the appointment. Don't forget follow-up. Avoid leaving without checking if there are any prescriptions, referrals, or next steps. Don't make it about you. Keep focus on your employer's needs, not your own opinions or experiences.